Good evening once again, ladies and gentlemen. Karibuni sana kwenye jioni njema ambao tutatambua kazi nzuri zinazofanywa na wenzetu, tukianza na Chia Innovation Awards, tukifuatiwa na Special PEPFAR Awards, na baada ya hapo tutatoa awards kwa different categories in the health sector. Karibuni sana.
Asante. So start with tutakuwa na Chia Award. This is part of the Innovation Award, and it will be done to among the three top most. We have Jonathan Zeramula, we have Rehema Sadan, and Herman Kamugisha. So the three will come here for 5 minutes each to present their work, and thereafter all of us will have to vote. We'll have to vote to see who is the winner, and the winner will be electronically displayed here. So to facilitate the voting process, I ask you, I know most of you have the smartphones, please can we use the QR codes here to scan and download the application for voting. The left one, Play Store, is for the Android, and the second one is for the smartphone, for the iPhones. For the iPhones, the devices. They call themselves their own devices. So these two here, not the program. So please scan one, make sure you have the application ready for voting after the presentations from the three colleagues that I just mentioned. Tumeelewana? Naomba to scan hii application kwa ajili ya voting, register kabisa, be ready for voting. The colleagues that I just mentioned, they will have strict 5 minutes presentation, and then all of us will be voting to see who is the winner in terms of Chia Award, that is Innovation Award. So we have 2-3 minutes for that before we start the presentations.
Thank you. Please let us know whether you are successful to access the codes. You have the app that will truly help to facilitate the voting process. The one on the left for Android, the one on the right for iOS. Would truly appreciate if you're able to get the app now so that we can smoothly do the voting after the presentations. Meanwhile, I would like the finalists to prepare for the presentations. I hope you are here. I hope you are close. I hope you are prepared and confident to start the presentations.
If you have difficulties in scanning, it's THS conference app. You can search it manually. If you have any difficulties in scanning, just search THS conference app in your iStore or THS conference app. Go to your iStore, Play Store, make sure you search for THS conference app and download it, register so that you can do the live voting. Scanning. I said if you have any difficulties in scanning, just search THS conference. Make sure to download and register. So I believe you're all set. Now, ladies and gentlemen, allow me to welcome Asha Ephraim to introduce the Chia Award in a minute, and then we can. Asha, karibu.
Good evening, everyone. Karibuni again to the 10th Tanzania Health Summit Awards and to the 4th Chia Awards. Asanteni sana kwa kuja na kuwepo mpaka sasa hivi. As our MC said, I'm going to introduce the Chia Awards. I'm happy to see some familiar faces about we already know what's the awards and what we have a little bit of experience. But for the people who are new, the Chia Awards are an innovation section for the Tanzania Health Summit where we award innovations in healthcare. So we started off 4 years ago where we only had about 11 applicants. This has grown over the years to our latest presentation to 54 applicants this year. We started off by collecting the applicants and then taking their applications to judges within the field of the healthcare sector, both in the innovation sector as well as in medicine and in tech. After this, we screened the applications. We had about 6 people. And after that, the 6 people presented their pitches to the panel of judges. And now we have our top 3 candidates. And these are our top 3 candidates. We have Jonathan Zeramula, who's going to be presenting his device, which is a point-of-care ECG integrated digital stethoscope. Rehema Hamisi Sadani, who is going to present Neo Health, and Herman Paul Kamugisha, who's going to be presenting his medical equipment management and maintenance planning system. So, this is the schedule for the next 20 minutes. Each presenter will have a 5-minute, sorry, that's a typo, a 5 minutes to present. We'll then ask you to vote based on the app that you have. You will receive a vote code, an individual vote code for everybody to be able to vote within the app. And voting will take about 10 minutes, and the winner will be announced immediately. For those of you who have not yet downloaded the app, those are the QR codes for Play Store and the App Store. And the app is also called the THS Conference app, in case you don't want to scan it. The first thing you do once you have the app is to sign up. Once you've signed up, you should be able to log in immediately. And that's the first page of the app. It looks like that. The second thing that you do is on the page, on the first page, there is an icon written Live Polls. Once you've clicked the Live Polls, you should be able to see the names of the 3 participants, the 3 competitors. All you have to do is to enter your code that the volunteers will give you, and then you can vote for whoever you see fit. We will then display the results immediately after voting has been ended, and we'll have our winner. That's it. Just to clarify, does everybody have their app ready? Is anybody missing the app?
Yes? Thank you.
Great. So I'd like to welcome our first presenter, Jonathan. Karibu.
Good evening, everyone. So let me just
So while the IT is sorted out the PowerPoint, we can use this on the left-hand side. Shortly, it will be on the bigger screen as a follow-up. Jonathan, you have 5 minutes. We'll start now.
My name is Jonathan Zuramula, and I am representing TechTiba. And at TechTiba, we aim at bridging healthcare and technology through creating innovative biomedical technology solutions. And we have started that by designing a point-of-care ECG integrated digital stethoscope. Now, we have done this because we have seen a problem in the society. So currently, the cardiovascular diseases are a leading cause of death, causing about 17.9 million deaths per year, and which accounts for about a third of the deaths that occur globally every year. And 75% of these occur in middle and low-income countries like Tanzania. And the borderline is that 4 out of 100 people in Tanzania die due to cardiovascular diseases. And the reasons are the changing lifestyle that we live, which is mostly sedentary and based on foods, but also there is increasing aging population, and there's late diagnosis of these cardiovascular conditions. So WHO suggests that early diagnosis and management is crucial for people at risk of cardiovascular diseases. Now, there are different technologies that are used for diagnosis of cardiovascular diseases, such as the stethoscope, which basically every doctor has, and the ECG machines. But are they fast enough to detect these cardiovascular conditions at a community level? Well, there is a problem, and because there are limitations in these devices, such as the stethoscope, it cannot be used by most of the medical professionals, and it needs a lot of time to study to use this device. But it is also limited in such a way that you cannot amplify sound to the level that you like if it does not see you fit. And it can be hard sometimes to detect some parameters without the integration of the ECG. So we have seen this problem, and we have decided to create a device that will be able to detect cardiovascular conditions by creating a user-friendly device that will have parameter detections, but also allow you to auscultate the patient while at the same time viewing the ECG, and also detect different parameters such as the heart rate, but also other cardiac conditions. This device will be easily accessible, and it can fit on the palm of your hand. As you can see here in front of you, I have this device that we have designed that will be able to detect different parameters of the heart, such as the heart rate, but also atrial fibrillation, and it can also detect murmurs at the same time, which will enable medical professionals, even those who are not trained for cardiology, to be able to get this data and send it to cardiology specialists so that it can enable for remote monitoring and remote diagnosis. This can be done through the mobile applications that we have with this application, but also an application for desktop computers. So with this device, we tend to commercialize it through different revenue streams by selling stethoscopes, but we have also a competitively priced device that will be used with different customer segments, such as hospitals and medical professionals, but will also be distributed in different ways. Now, there's a big market opportunity because there are almost 3,000 medical doctors in Tanzania, and if we decide to target only these and sell them this device so that they can be able to provide primary health care in the community, we can be able to sell to almost about 1.5 billion in average sales with a price that we have competitively placed. Now, of course, there are other competitions that we have, but our advantage will be many features that we uniquely have, such as detection of early detection of parameters and heart conditions, but also the production in the country will enable the device to be of low cost. So we tend to grow by acquiring more customers, but also retaining our customers through exceptional customer support, and we scale for global expansion of our device. So our team is as a leadership of biomedical engineers who have medical expertise in designing of medical devices, but we have also a financial manager that will guide us through our financial journey, but also we have a medical lead and the advisors so that you can guide us in the development of this device. So what we seek now is a funding of 20 million shillings to develop a minimum viable product so that we can take it for testing and evaluation, but also we seek mentorship and acceleration so that we can take this device for commercialization and it can be able to reach people so that we can detect early signs of cardiovascular diseases and be able to save the lives of people. Thank you for listening to me.
Great innovation. Thank you very much, Jonathan, for the presentation. Thank you for the innovation. A big round of applause once again, Jonathan. Asante sana. So we'll now welcome on stage Rehema Saadan to present on her innovation. Rehema, welcome on stage. A big round of applause as she walks on the stage. Asante na karibu sana.
Good evening, everyone. My name is Rehema Misadani, and I'm presenting Neo Health Innovations. Well, we are providing neonatal care devices to help healthcare providers improving their services, but then saving the lives of newborn babies in our African communities. According to UNICEF data, we have discovered that approximately 106 of newborn babies die every single day before reaching their first month of life. And there are various causes of their death. But 57.2% of these deaths are associated with the decrease of their body temperature due to prematurity. There are several devices that are used to cure this condition, including infant radiant tumor. But in our local hospitals, the current warmers are from donation and few are imported. The donated warmers, they miss spare parts, they are difficult to maintain, the machine language that comes become difficult for the healthcare providers to understand. But also they are too sophisticated. On the other hand, the imported warmers, they are very high maintenance costs, but then they are not suitable for our environment. So we came up with a solution called Local Infant Radiant Warmer, or RILA, which is the medical device used to maintain the infant's body temperature at a specific range of 36.7 degrees. We have completed our prototype, and that's the picture for our prototype. It has the bed on which a newborn is placed, an overhead heater on which radiation energy is settled to the baby. But then we also have a sensor which is attached to the newborn baby to monitor the variation of the temperature. But then we also have an alarm system to alert healthcare providers if there's any changes when using the device. We also are developing a backup power system to help in any power shortage. We offer our clients with a user-friendly device, which is very simple to use, does not need any much of expertise to use it, but then durability, we are using the local materials which are available here in Tanzania, but then they are compliant to ISO standards. It's also affordable. We offer our clients with 2 years warranty of maintenance services, but then supply of the spare parts. Our target markets are dispensaries, healthcare centers, and hospitals. We make money by selling RILA, renting them in some of the hospitals, and conducting maintenance fee soon after the maintenance warranty finished. We conducted about 30 interviews from 8 hospitals, and about 75% of their response were positive and ready to purchase. Of course, every business has a competition. We also have competitors like donated warmers and imported warmers. The donated warmers, they're missing spare parts, some are broken, and there is a machine language which is difficult for the healthcare provider to understand, but then it's very expensive to maintain. Likely, for the imported warmers, they are very high maintenance costs, and then they are not favorable to our environment. Right now, we are improving our device to make better version for our products, but then we are doing a consultation with the TMDA for the approval so that we can go for the clinical trials, and then we are going for certification so that we can get the certificate to go for the mass production. We forecasted about for 5 years to come to sell about 100 pieces of RILA at a price of $2,500. We are raising about $150,000 for our activities like purchase of raw materials, the machinery, marketing and PR, working space, assembly and testing, and logistics. Our team is full of expertise. We have in engineering part, we have a mechanical engineering, industrial, biomedical, electrical. Also, we have a medical doctor and a finance officer.
Thank you, Rehema. The time up, and I think that was enough. Sante, round of applause for the Badan, please. Sante na hongera sana for the good innovation. And now, the last one in the list is Herman Kamugisha. This is the last one to present, and we're talking about a platform which serves to facilitate collaboration among individuals for medical equipment and stakeholders. You have 5 minutes. Kamugisha.
Okay, hello.
Hello.
I am Herman Kamugisha, and today I want to share a story with you. 2 years ago, I was doing my intern at a certain hospital, and during connecting with the healthcare people, they gave me their challenges, which I found like 4 key points. So the first one, it was difficult for them to know the exact location of all the equipment in that facility. So for example, an hospital, it has a lot of equipment, like more than 100 sometimes, and if you don't have a good database, a good place where you see each location and each status of each equipment, then it's always difficult to manage everything. So another problem was, as we know, in the hospital, the equipment, they need servicing. Medical equipment are just like maybe cars. You can see if you cover 1,000 kilometers, you have to change the oil so that the engine can stay healthier, so it can last long. The same for medical equipment. We need to service them so that they can keep producing good results, and we can also extend their life. So seeing this problem in the hospitals, one of the challenges also, we found like X-rays, there are very few in our country. You find maybe in one region, maybe we have 4 X-rays, but you find only 2 are working. And the reason behind is it was maybe there were late maintenance for maybe 1 month, and that maintenance could cost people's lives. Maybe 2,000 people could not take the X-ray procedure, or you find many people are congregated just waiting for the services because the equipment are there, but they are not working. So I am happy to announce that we have the solution. And the solution is MEMPLUS. Now, what is MEMPLUS? MEMPLUS is a software, it's a tool. It helps to keep everything in one place. So you see all your equipment in one place, you know their status, you know where this equipment is, and if anything happens, then for some equipment, they have the sensors, so it just automatically reports everything. So as an engineer, as a biomedical personnel, you see that a certain equipment has the problem, and you can take quick actions. It also helps to schedule the maintenance. We use artificial intelligence to schedule those maintenance. So if you have an MRI, then since we have a database of all the things that we need, then we can know what procedures are needed to be done. So it alerts you a month before that procedure, 2 weeks before, 1 day before, so that you can get prepared before everything happens. So we also connect the health facilities, the hospitals, the dispensaries and everything with their medical suppliers or the medical vendors, the medical equipment vendors. So when we buy the equipment, we just, when it has a warranty, if anything happens, if the equipment just reports maybe there's a fault, then the service provider will get a notification too, so you'll come there in time. And you can get statistics, we can see maybe what time it took for people to act on that notification. So as an owner, you can see maybe people, if they're doing their maintenance or if it's not done. So you always be aware. But we also correct data which can be used in research. Maybe we want to know maybe a certain kind of equipment is favorable for our environment. Or you can also know the causes of the faults of that medical equipment. So sometimes you find maybe it's electrical faults or something like that. Now, what are the advantages which we are going to get when we use MEMPLAS to manage our medical equipment? Then this is going to increase the accuracy, because if you don't do maintenance, then you're going to get poor accuracy of your medical equipment. So you might find if you have not calibrated maybe a certain lab equipment, then how sure are we that the results are going to be correct? If you have not calibrated for 2 years maybe. So there is a chance that you're going to get the wrong results. But also, if the equipment does not work, then it disrupts the operation of the hospital. So you found like people are waiting for services. While if this could be done maybe 2 days before, then nothing could have been making these people wait. But also, according to the report of WHO, like $4.7 billion are wasted due to not doing the maintenance and due to equipment breakdown. This could be in terms of machinery and in terms of time and the trust that we are losing from our patients or our clients. So it's important using a software like this, because as we know, our country is trying so much to increase the numbers of the medical equipment in many hospitals. So with this software, it's going to help them to see the conditions of the equipment, but also to make sure that the equipment are working efficiently so that the operation could go smoothly. Our current progress, we are currently testing this software in 3 institutions, one of which being the Muimbele University in their teaching labs.
Yes, Herman, thank you very much. Our time is up, and thank you for very good innovation. Round of applause for Herman Kamgisha for that innovation. Thank you very much. Now, ladies and gentlemen, shortly we'll receive a code for us to vote. Remember, we had 3 presentations for innovation, the Chia session. We have Jonathan Zeramula on the ECG, integrated stethoscope, Rehema Sadan on the Neo Health, and Herman Kamgisha on MEMPLAS. I know all of us have the application and have signed through the app. We should be able to receive the codes.
Okay, I think we are all now at the app. Tumefika. You will see a section written live voting, live polls. I believe we are all there right now. 3 very good innovations from very vibrant young people. Now is your time to decide, moment of truth. You will decide which innovation should be awarded. Please go to the live polls and then vote for the one that you'd like to be awarded the Chia Awards. If you face any challenges, please let us know. The IT team is here to support. we have a cord with us? Do we all have a cord? Something like this? Do we all have it? Thank you. Okay. Hamna uchawi, hakuna kupendelea. It's all on your hands. No, it's not working?
The IT team, please, can you help? If you have any challenge in voting, make sure you're using the code that you received. One code for one person to vote only once.
Ushindi wao mikononi mwenu.
Kumbuka shilingi milioni 5 kushindaniwa hapa. Kwa hiyo kura yako
Worth 5 million for someone today to get the innovation going and up. IT team, please support. Asante, tunaona watu wengi imekubali, but few technical difficulty here and there, and our team is here to support.
So
5 million.
One
5
IT
million.
person here, please. We have 2 people struggling. Your vote is worth 5 million, and is going to make a decision who goes out of this room today with 5 million of pocket.
Three young people, 3 very good innovations to address real challenges in the health sector. And the decision is on your hands. If you're still facing any challenges, please wave so that the IT team sees you and come to assist.
So if you're still having a challenge, please make sure your hands up. I know all of us, we are voting now, so the network could be jamming somewhere, but we should be able to vote. A card? Asha, please, a voting card here. One card can only be used once. Can I see the hands of those who have voted successfully? Oh, wow. So we have few hands which are still, their vote is still yet to go, and we have to wait until we have all voted.
Okay. Thank you to those who have voted already. And thanks for those who are continuing to vote. Yeah, so the 3 innovations, 3 very good innovations, what are they bringing to the table? As you are voting, let's really rethink and think.
IT team, I see 3 hands here still, 4, 5, please. Let us sort them, because the decision is very critical. We are talking about 5 million TZS cash. man here.
Yeah, thank you. 5 million for innovation that ensure and improve accessibility, affordability of healthcare services. You know, so when we look at the innovation, we just need to think, does that offer us that? Affordability, accessibility of healthcare, as well as the quality, you know. Will it improve the quality of care? Will it improve access? Will it improve the affordability? So as we vote, let's keep that in mind. Very good innovations, all huge potential, and that's how they go to the final. We have 2 minutes to finalize voting. So we heard very good presentations, innovation from Jonathan Zeramula on point of care ECG integrated stethoscope, Rehema Sadan on Neo Health, and Herman Kamugisha on MEMPLUS. Very good innovation from our young people. All have a potential to improve our healthcare system, but there will just be one winner. So as we are thinking who that one winner is, let's reflect. Will the innovation improve access? Improve the cost? You know, will it make healthcare more affordable? Will it improve the quality of services that everyone receive at the facilities? We have few minutes to close the session. And silence, I think, means we are heading there. We are finalizing the process. Great innovations, and very soon it's going to be a moment of truth when we know out of the 3 innovations which one walks out of this door with 5 million. And as we are winding up the first session, I would just like to let you know, after the Chia Awards, we'll go to the PEPFAR Special Awards. So we nominated quite a few people. Soon we'll know who out of those ones were able to be selected as winners.
Are we all set? Are we all set? Is anybody still struggling with the vote? Silence means we are.
Yeah, we are almost there. Almost there. We'll soon do a countdown. On the screen are the three finalists: Herman, Rehema, and Jonathan. The top three finalists. Are we all set? Should we do a countdown? So let's start. 3, 2, 1. And the winner is Jonathan. A big round of applause. Jonathan Zeramula is the 2023 Chia Award winner. Hongera, hongera sana, Jonathan. So hongereni sana, all the three finalists, but many, many, many congratulations to our winner, Jonathan Zeramula. Thank you. Na sasa ninaomba wanaokabidhi award waweze to move to the stage.
So, to present the award, Dr. Omar Chilo, President THS, Dr. Chaku Halfan, Jessica Green, and Catherine Misiga. Tafadhali, please let us move forward to present the award to Jonathan Zeramula, being the Chia Award winner for 2023 THS. And now, ladies and gentlemen, a round of applause again for Jonathan Zeramula. Please, Jonathan, come forward. Big round of applause, please, again and again, as Jonathan receives that symbolic check of 5 million TZS. Naomba picha ipigwe nzuri kabisa. Kazi.
Perfect, perfect. Whoa, yeah!
Yes. That was excellent.
Congratulations, Jonathan. Congratulations, THS, for this innovation and recognition. Tunawashukuru sana.
Jonathan, simama hapa sasa pembeni na rais upate picha.
Congratulations, another great.
A certificate and a trophy for that win. Yes.
And a dummy check, 5 million. Congratulations, Jonathan. Congratulations, THS and Chia Innovation Awards. Asante sana.
So, ladies and gentlemen, now we move to the next category of awards, and now we are going to the PEPFAR Special Award. And can you please put your hands together for Jessica Green, the PEPFAR coordinator for Tanzania, who will be coordinating the process. Karibu, Madam Jessica.
Good evening. My name is Jessica Green. I am the PEPFAR Country Coordinator here in Tanzania, and I'm very happy to be here this evening to present a series of HIV Hero Awards. Hopefully you heard yesterday as part of the opening that PEPFAR is commemorating its 20th anniversary this year. And so our awards as part of the Tanzania Health Summit are really to recognize and acknowledge all of the efforts that have gone into supporting Tanzania to reach its HIV epidemic control objectives. We have five awards this evening. So I have the honor of describing both the award and the winner, and I think after each, we'll ask each person to come up and receive a plaque. So our first award this evening is the Community Impact Award. This award is given to a community health worker who has significantly impacted his or her community's HIV response. The winner of PEPFAR's 2023 HIV Hero Awards for Community Impact is Mr. Tobiko Sapalala.
Congratulations.
Sorry, can I tell you how great he is? Mr. Sapalala is a community health worker in Ngorongoro, DC, and a member of the Council Multisectoral AIDS Committee, where he has advocated for rights and the voice of people living with HIV in service since 2008. His community advocacy and engagement in the Maasai community has helped to support people who are currently on treatment. Thank you.
Tobiko, asante, karibu sana, hongera sana, hongera sana. Hongera sana Tobiko, mtoa huduma ngazi ya jamii. Asante. Great recognition.
Our next award is the Young HIV Champion Award. This award is given to a young person who has been an HIV champion among their peers, working to create a better future of the youth of Tanzania. There are two winners. The winners of PEPFAR's 2023 Young HIV Champion Awards are Ms. Marcelina Mulokozi.
Hongera, hongera, hongera sana Marceline.
And Mr. Pascal Lucas Mapunda. Ms. Mulokozi is a member of the South African Development Community Youth Parliament and has contributed to training adolescent girls and young women on HIV/AIDS through both in-person and virtual training. She works to raise awareness on new HIV prevention interventions integrated with DVR. She recently gave a talk called Let's Talk About DVR to reach young people. Mr. Mapunda is a nursing student from the University of Dodoma who uses his social media platforms and radio stations in Dodoma to increase knowledge about HIV/AIDS. Through his social media platforms, he addresses social stigma against people living with HIV/AIDS. Asante sana.
Hongereni sana, hongereni sana. Hongereni sana Marcelina na Pascal. Champions, 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 champions. Makofi mengi mengi jamani. A big round of applause to our champions. Hongera Pasco. Hongereni.
Sana. Hongera sana Pasco, the champion.
Our next award is the Clinician Award. This award is given to a clinician who has significantly impacted his or her community's HIV response. The winner of PEPFAR's 2023 Clinician of the Year Award is Dr. John Ngowi.
Dr. John.
Dr. John Ngowi kutoka Ocean Road Cancer Institute. Hongera sana Dr. John Ngowi.
Dr. John is a medical doctor from Ocean Road Cancer Institute who has mobilized and recruited more than 5,000 HIV-positive women to undergo cervical cancer screening and genotyping access across Bagamoyo, Chalinze, and urban Dar es Salaam. Asante sana.
Hongera, congratulations, John Ngowi. Clinician Awards. Dr. John Ngowi, hongera sana. Hongera sana, asante sana.
And last, but definitely not least, is our Lifetime Achievement Award. This award is given to an individual who has committed a lifetime of service to the HIV response in Tanzania. The winner of PEPFAR's 2023 Lifetime Achievement Award of the Year is Dr. Leonard Maboko.
Hongera sana daktari. This is a lifetime achievement. Naomba tusimame tumpigie makofi. Asante sana, asante sana. Hongera sana daktari. Thank you for your service. Thank you for your commitment. Thank you for all that you do. Hongera sana daktari. Asante sana.
As I'm sure most of you know, Dr. Maboko has over 20 years experience in coordination and management of HIV and AIDS programming in Tanzania. He even predates PEPFAR. In his role as TACAID's executive director, Dr. Maboko provided strategic leadership to coordinate the implementation of a national multi-sectoral response to HIV/AIDS. He was also a main advisor to the Prime Minister's office, where he led the Prime Minister in the development of the costed 5th National Multi-Sectoral Strategic Framework on HIV and AIDS. With his background in HIV, STIs, and TB research in Tanzania, Dr. Maboko led TACAIDS and HIV response stakeholders to adopt amendments of the HIV and AIDS Prevention and Control Act to allow for HIV self-testing in adults and helping to lower the age of consent for HIV testing from 18 to 15 years. Dr. Maboko has always worked to create awareness of the challenges around HIV with over 80 scientific publications in international and local journals, as well as continuous advocacy to remove policy barriers to ensure inclusivity in the HIV response. In his role as the co-chair of the Tanzania HIV Impact Survey Steering Committee in 2016 to 2017, Dr. Maboko played a pivotal role to ensure that the results were used to implement strategic and programmatic shifts to enhance identification of people living with HIV. Dr. Maboko is a natural-born leader, teacher, and a mentor to many. Through his commitment to the fight against HIV over the last 20 years, he is a bold leader who paves the way for the next generation. Asante sana.
Asante sana.
Makofi tena kwa Dr. Maboko tafadhali. Big round of applause for Dr. Maboko for this special recognition.
Hongera sana, hongera sana. Hongera sana daktari. Tunakushukuru sana kwa kazi yako.
A well-deserved gift.
Very well deserved, very well deserved.
Wengine tunamuita baba mchungaji.
Asante, asante.
Mchungaji Maboko, Dr. Maboko.
Congratulations to all the winners who will also be receiving a cash prize in addition to these plaques to take home. And a big thank you to all of you who voted to identify these HIV heroes. I think we hope that this can become an annual part of the award ceremony at THS. So thanks everyone, enjoy your evening.
Thank you very much, Jessica. Before you take a seat, tunaomba PEPFAR team, THS, as well as the awardees wa leo, mje hapa mbele kwa ajili ya group photo, alafu tutaingia kwenye healthcare awards, then cocktail. So, karibuni wale waliopokea awards leo.
PEPFAR team,
Meselin, Pasco, Tobiko, John Gowi, Dr. Leonard Maboko. Karibuni hapa kwa ajili ya kupiga picha.
The PEPFAR team present, including USAID and CDC, DOD, please. This is a very important photo.
Tunaomba pia mwakilishi wa wizara aweze kujoin picture. Asante. Asanteni sana wawakilishi wa wizara zetu. Thank you. Very well deserved awards. We appreciate for recognition of all the people who are working very hard day and night, saving lives, improving quality of care, improving policies, etc. Thank you, the ministries, for your guidance. Thank you, THS, for this platform.
Asante sana.
Asanteni sana. Asanteni sana. Asanteni sana.
Asante sana. Mabibi na mabwana.
Ladies and gentlemen.
Sasa muda umewadia kwenye zile award ziko 8. Tunazo awadi 8 zimesalia. Tutaanza na award ya Community Healthcare Worker of the Year. Itafuata award ya Medical Laboratory Scientist of the Year, Pharmacist of the Year, Nurse of the Year, Doctor of the Year, Public Health Officer of the Year, MOI or Medical Officer in Charge of the Year, and later DMO of the Year. So we have 8 awards, and Dr. Anna, can you please talk about these awards and the history behind it?
Okay, who were here last year? Nani alikuwepo hapa mwaka jana? Asante. Wachache, basi awards hizi started last year to, recognize efforts of our healthcare workers. And then, some of the winners who received award last year were able to go and receive global recognition. For example, Wilson Fungameza, who was the Nurse of the Year last year, made it to the top 10 finalists among 52,000 nurses across 202 countries for the Asta Guardian Global Nursing Award 2023. And with that, as people see more and more value of this award, and also for recognizing people who are doing great work, this year's award have grown to over 500 nominees among the 12 healthcare categories and received over 30,000 votes. So now, we would like to go to the moment of truth where we announce to you healthcare heroes of 2023 in the categories that were previously mentioned.
Before we go to this category, I'm reminded by the organizing committee that the cocktail party will be starting immediately after these awards, so please don't go nowhere. And we'll have the live band by Banana Zoro yet to be here, so please plan not to leave this place for the next at least 2 to 3 hours after the awards.
Thank you. Great party waiting for us out there. Please don't leave. We need to go on celebrating these awards. So now we would like to start with the Community Health Worker of the Year 2023. And the finalists were
Fausta Michael.
Sorry.
No, not this one.
Okay, vile tumeshamjua. Tutaanza na Public Health Officer of the Year. Na kama, as we see on our screens, the one who has majority of votes is Fausta Michael from the Ministry of Health.
So to present that to Fausta Michael, the Public Health Officer of the Year, Dr. Otilo, Dr. Chako Halfan, and Jessica Green, please. The floor is yours.
Fausta, please walk on the stage. Fausta is there. Hongera sana Fausta. Congratulations to Fausta. Congratulations to those who nominated her and voted for her. Hongera sana Fausta. Congratulations. Great job. Okay, so now we'll go to the Community Health Worker of the Year.
So for the Community Healthcare Worker of the Year, we had 3 finalists, and these are Leonard Nzoa from Benjamin Mkapa Foundation, Vedastus from Amref Health Africa, and Luz John Bosco from Dikoko. And ladies and gentlemen, the winner is...
Yeah! Okay, Tobiko once again. Hongera sana, Community Health Worker from Ngorongoro.
So, this is what was just presented for the PEPFAR, the community impact. So the names I just mentioned, Tobiko, tafadhali kidogo. So the winner of the Community Healthcare Worker is Leonard Nzoa from Benjamin Mkapa Foundation.
Apologies, some technical glitch there. Winner wetu ni Leonard Nzoa from Benjamin Mkapa Foundation.
Asante, the same team please, who presented Jessica, Dr. Omare, Dr. Halfan, please. Let's present the THS Award.
Hongera sana. So in addition to the certificate, they also receive a cash prize of 1 million shillings. Hongereni sana. Tunawashukuru wanao nominate, tunawashukuru wanao wavotia. Thank you very much. Our appreciations to you for the good work and for those who recognized. Congratulations, Leonard Nzoa. Congratulations.
Now we move to the next category, and this is Medical Laboratory Scientist of the Year. The finalists were Ambele Elia Mafulango from National Public Health Laboratory, Rahima Ali Sumri from Muhimbili National Hospital, and John Kambala from Director Kids. And the winner is Rahima Ali
Sumri.
Rahima, please. Rahima.
From Muhimbili National Hospital.
Rahima, please. Again, Dr. Chilo, Jessica, and Dr. Halfan.
Congratulations, Rahma. Congratulations to Muhimbili National Hospital. Congratulations to those who nominated her and voted for her. Very proud of you, Rahma. Medical Laboratory Scientist of the Year 2023. Same cash prize, 1 million in addition to the certificate.
Ladies and gentlemen, now we are moving forward, and this is Pharmacist of the Year Award. And the finalists were Beatrice Revocatus Mukungu from Kwad Health Center, Professor Eliangringa Kale from Muhimbili University, and Muhijidin Vaji from Aga Khan Health Services, Tanzania. Ladies and gentlemen, the winner is Professor Eliangringa Kale.
From MUHAS. Congratulations, Professor. Very, very well deserved.
Very well deserved. Lecturer, researcher, research and R&D lab at MUHAS. Again, Professor receives a trophy and a cash of 1 million. Pharmacist of the Year 2023 THS.
Congratulations, Prof. Congratulations, MUHAS. Congratulations to those who nominated Professor Kaale. Asante.
Okay. From Pharmacist of the Year, step ahead now. We are now moving to Nurse of the Year Award. And the finalists were Neema Lamek Simon from Igunga Dispensary, Baraka Gonzalve from St. Benedict Ndanda Referral Hospital, and Somoe Halfan from University of Dar es Salaam. Ladies and gentlemen, the winner is and the winner
the 2023 Nurse of the Year Award goes to the Nurse of the Year Award.
Yes.
This is a very, very special award, as we all know. Yeah? The nurses, the drivers of the healthcare. There we are! Yay!
Neema Simon from Igunga.
All the way from Igunga. The 2023 Nurse of the Year, Neema L. Simon. Hongera sana. Congratulations, Neema, for that award. Igunga Dispensary, congratulations. We are very, very proud of you.
Nurses are the pillar of the healthcare services
Yes.
at the primary healthcare. And the doctor, our clinician of the year, is next.
Hongera sana Neema.
Hongera sana. Ladies and gentlemen, now we are moving another step ahead. 2 more to go, 3 more to go. Maybe yours is coming next. Keep warming up. Now it's Doctor of the Year. We had 3 finalists. Dr. Hussein Karim Manji, Aga Khan Health Services, Tanzania. Dr. Stella Malangahe from Benjamin Mkapa Hospital, Dodoma. And Dr. Stella Mpagama from Kibongoto Hospital, Kilimanjaro. Ladies and gentlemen, and the winner is...
All right. The 2023 Doctor of the Year Award. Yay! Dr. Stella Malangahe.
Dr. Stella Malangahe.
From Benjamin Mkapa Hospital.
Yes.
Very proud of you, Daktari. Congratulations. Well done. Hongera kwako. Congratulations to Benjamin Mkapa Hospital. Asante sana for all that you do. Hongera sana Daktari. So the next award is the Medical Officer in Charge of the Year. And the finalists, we had 3 finalists for the Medical Officer of the Year.
So, and the finalists were Dr. Jacqueline Mlai from Kakonko Kakonko District Hospital, Dr. Alex Ernest Ibolinga from Mount Meru Referral Hospital, and Dr. Zaveri Benela from Mwananyamala Regional Referral Hospital. Ladies and gentlemen, Moi of the Year Award goes to Zaveri
Benela
from Mwananyamala.
Mwananyamala, Dr. Zaveri Benela.
I know Dr. Zaveri is not with us here, but he will be represented. Naomba yule aliyechaguliwa kumwakilisha Dr. Zaveri. Asante sana.
Hongera sana. Salamu zimfikie. The one who is receiving is representing Dr. Zaveri Benela, Medical Officer in Charge of Mwananyamala Regional Referral Hospital. Medical Officer of the Year 2023. Asante sana. Asante sana. And now the final award. The DMO of the Year.
District Medical Officer of the Year Award. This is the final award tonight before we go for the cocktail and the banana zoro, which is just next to. And ladies and gentlemen, the finalists were Dr. Raphael Joseph Mhana from Nanyumbu District Council, Mtwara, Dr. Waziri Mustafa from Musoma Municipal Council in Mara, and Dr. Frank Mganga from Meatu District Council, and now he is in Njombe District Council. Ladies and gentlemen, DMO of the Year, THS 2023, award goes to...
There we are.
Yes.
There we are.
There we are.
Our final award for the day.
Very special.
THS 2023 DMO of the Year 2023. Very, very special award.
These are the people who makes our work easier.
Yes. Yes.
Yes, Dr. Frank
Ganga. Perfect.
District Council, and he is now in Njombe District Council.
DMO of the Year, Dr. Frank Mganga.
Mganga. Makofi mengi tafadhali.
Makofi mengi kwa daktari.
Wakuu wa idara wachache sana bado wako hapa, ikiwemo Dr. Frank mwenyewe. Zawadi muhimu sana hii, utambuzi muhimu.
Congratulations, Dr. Frank.
Dr. Frank.
Very proud of you. Hongera kwako. Hongera Njombe. Hongera to those who nominated Dr. Frank.
Hongera Meatu.
Hongera Meatu walipomtoa kabla hajahamishiwa Njombe.
Yes.
Great work.
Great work.
Hongereni sana all the winners of the Healthcare Awards 2023. Na sasa kabla waheshimiwa wetu hawajaondoka on stage, can we have all the awardees come on stage?
Jessica, please.
Wow, great.
Yes.
Tunawashukuru wale waliopiga kura nyingi sana. Maua yetu hayajarudi.
Washindi wote naomba tuje na tuzo zetu hapa mbele. Washindi wote tafadhali tuje tupate picha pamoja. Washindi wote tuliopata THS Award, THS Awards hizi 8. Wale washindi tuliopata hizi award 8.
Healthcare Awards. Community Health Worker of the Year, Leonard. Medical Laboratory Scientist of the Year, Rahma Ali Sumri. Pharmacist of the Year, Professor Eliangiringa Kaale. Nurse of the Year, Neemaeli Lamek Simon. Doctor of the Year, Dr. Stella Mbalangahe. Public Health Officer of the Year, Dr. Fausta Michael. MOI of the Year, Dr. Zaveri Benela. And DMO of the Year, Dr. Frank Mganga. Hongereni sana. A lot of congratulations to you. Thank you for your hard work. Thank you for your commitment. Thank you for all that you do. Asanteni sana. We appreciate your work. Asanteni sana.
Asante sana. Jamani, now after this picture, you can take pictures with any winner you want, but what follows next is cocktail and
party, cocktail and live band. Cocktail and live band is out there.
Karibuni sana kwa ajili ya cocktail, kwa ajili ya live band. Tukutane kesho. Tukutane nje pia, tukutane kesho.